Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, student. How are you today? Okay, I'm glad to hear about you, that you are all of fine. Okay. Now, I can see you again in the English 5 subject. Okay. Today's topic is about the day of the operation. Okay, I think all of you have experience. You took care of the patient when you did the clinical placement. Okay, in the hospital last semester. Okay, all right, student. Okay, when you took care of the patient. Okay, in medical ward, the day of the operation, so you are working as a surgical nurse. Okay, who is a surgical nurse? Okay, surgical nurse is a theater nurse. Okay, also we call with theater nurse or scrub nurse. Okay, so in the hospital, if you are working as surgical nurse, okay, another health practitioner, they can call you with the theater nurse or scrub nurse. Okay, that you are specialist in preoperative care, providing care to a patient before, during, and after the surgery. Okay, so you are surgical nurse. Okay, student, to be a surgical nurse or theater nurse, so you have to go to the university. Okay, and then you got the registered nurse or enrolled nurse must complete extra training. Okay, if you're working in overseas. Okay, so you continue to be a nursing student in the university level. Okay, there are different specialty area in nursing. Nurse can focusing on which area that you are interested in. Okay, so this is surgical nurse. Let's have a look here. What is the day of the operation? If you are working in the theater room, okay, there are many different phase during surgery where the theater nurse is need to support and assist your patient, surgeon, surgical technician, nurse anesthetics, and nurse practitioner. So you are working together to take care of the patient, to overcome the health problem that patient suffer from. Okay, so during the preoperative, okay, the nurse, you should help the patient to prepare, okay, and operating room for the surgery. And then during the day of the operation, during the surgery, you assist the anesthetic and surgeon when they are need. Okay, and then the last phase is the post-operative. Okay, this is to ensuring that the patient are provided with suitable care and treatment. Okay, so this is the phase during the surgery. Okay, I think all of you familiar with this topic. Okay, student. All right, student. Don't forget when you are working in as a surgical nurse. Okay, surgical nurse. So you have to work with the vocab or grammar that usually used in the day of the operation. Okay, what kind of new vocab that you have to understand? The first one, this is tap. Okay, this is unusual vocab. Okay, unusual, but if you are working the day of the operation, you have to know about that. What is the meaning of tap? This is a small record with a label used to identify your patient. Okay, this is tap. Usually we use in the race. Okay, and then I'm going to give you. Okay, so you have to to say to your patient in the day of the operation, I'm going to give you something, okay, like injection for example. So you express a future action, okay. So this is the simple future tense, okay, which has been premedicated, that is an intention. It may also express the speaker's certainty that the action will occur, okay. All right. For example, you are working with a patient who has the problem with the right inguinal hernia. What is that? This is part of the body which protrudes between the pelvis and the right leg. Okay, all right. Okay, what is the neck? Okay, to wheel someone in. Okay, if you're working with the patient and then you have to wheel someone in, it means that to push someone in a wheeled vehicle or on stretcher into a room surgery. Okay, yes. And then you have to say, let's wheel him in. Okay, your friends in the day of the operation will say, let's wheel him in. Okay, it means that let us, let plus object, and then there is infinitive. Okay, it's used to all patient of imperative. Okay, except in the second person. Okay, you have to know about that. And then you have to lift someone onto the table. Okay, what kind of table? This is table to rest someone, put him for the surgery. Okay, yes. All right, student, this is for the exercise for practice. Okay, don't worry about it. This is very easy. Okay, you have to be familiar and get practice. Okay, if you say, I am about to give you an injection, this is incorrect sentence. Okay, yes, be careful. Okay, what is the correct sentence? I am going to give you an injection. This is the correct sentence. Okay, this is for independent study. Okay, okay, student, understand? Okay, don't forget. Okay, you have to do this grammar practice in your lesson time. Okay, in the independent learning study. Okay, activity at home. Okay, I give you one example here. Okay, if you say I am about to give you an injection, someone will understand what you are saying. However, your grammar is incorrect. Okay, be careful. So what should the correct sentence? I'm going to give you an injection. Okay, all right, I think it is clear. Okay, yeah, you can do it by yourself. And then here, this is a short grammar practice. Use the gerund as so in the example. For example, start to account. This is, it can be understand your patient. Okay, however, your grammar is poor. Okay, so you have to change with the good sentences. Okay, start counting, please. Okay, this is more better than start to account. Okay, so better you have to use start counting, please. Okay, all right, student, look at another grammar practice 3. Okay, the following sentence, this is a suggest. Okay, wheel him in. Okay, you have to put let's wheel him in. This is more polite. Okay, more polite, and this is a good language. If you say let's wheel him in, don't say wheel him in. It's not good. Okay, understand, student? Be careful. If you want to improve your English, so you have to practice in daily of life. Okay, don't be shy. You have to speak English. Okay, okay, student. All right, this is my advice. If you want to improve your English, okay, you have to learn every day and get practice. Okay, with your friends. Okay, with someone around you that understands English. Okay. How about the grammar practice 4? Okay. In here, you have to put the preposition or adverb. Okay. What kind of preposition and adverb that you can use? The first one is in, and then before, for, on, onto, and up. Okay. I give you one example. I'll be there. What kind of answer? I'll be there in a minute. Okay. Okay. I think it is clear. Okay. All right. Now you can do it the next question. Okay. The rest question you have to do until finish. Okay. All right. This is for independent learning study. Okay, student. All right, student. Another vocab that you have to understand. Okay. Someone, they give you something. This is for the before the operation. Okay. Someone will ask you. Okay. So this is about interrogative sentence. Okay. So are you? Is he? Are they? Have you? Must I? Shall I? Okay. This is about interrogative sentence. Okay. All right, children. And then a gown and a cap to put on. What is a gown? Gown here, it means that the special hospital clothes to wear for an operation. Okay, gown. In daily life, okay, gown. Oh, gown. This is something clothes that used by female. But in here, it means that special clothes to wear for an operation. Okay. And then if you give something and then to make someone feel sleepy. Okay. So to make plus object and then followed by infinitive. Okay. To make. And then what is object? Someone. Infinitive. Okay. Feel. To infinitive. Mean that cause someone to do something. And then to feel one's mouth dry. This is to have a dry sensation in the mouth. And then a small prick. If you give an injection to the patient, it will cause a slight pain caused by a needle. Okay. If you give your patient an injection and then it can cause a slight pain caused by a needle. Okay. Alright, student. Here another grammar practice that you can do. This is about the auxiliary. Okay, is, are, have, can, and my. Okay, that's this do, does, and did. Okay, so you can put here. Okay, in the gap. Okay, missing. Okay, blah blah blah. I come in. Okay, what is the correct answer? My I come in. Okay, my I come in. Okay, yes, you might. Okay, all right. You can do the rest by yourself. Okay, student. In English, the listening section, I think it is the most problem for us, especially from English is not the second language. Okay. English is not the first language. Okay, for like us. Okay, this is very difficult about listening, but don't worry about that. Okay, don't be confusing, don't be panic with the listening. Okay, how to improve your listening skill? You have to listen music. Okay, watch the movie. Okay, and then listen the music, what movie. Okay, with English. Okay, you will improve your listening skill. So do you have this annoying problem? Everyone has the problem. This is the normal life. Okay, you can understand native speaker, you cannot understand. Okay, but if you try, okay, try again, and then you will be used to, we're familiar with that, used to. You find it difficult to improve your listening. Okay, don't worry, you have to find someone okay, and then working together, okay. So you don't have time to improve your listening skill. You have to spend your time, okay, even though just 10 or 15 minutes, to improve the listening skill by listening the music, watch the movie, for example, from YouTube. It's okay, okay. Listening skill, there are only one reason people fail. Why? Because they don't listen to enough English. They don't listen to enough English. How to improve? Makes sense, right? If you are spend 1,000 hours listening to English, your listening will definitely improve. Okay? Believe it. Okay. Unfortunately, here what many people do to improve their listening. Watch a few movie in English every week. Okay, every week, every day. Okay, listen to something in English 3 or 5 times a week, for example. Listen to English for 15 minutes per day. Just a short time, but you have to do routinely, okay, every day you have to do it. And then these actions are weak. They are not significant enough to make a difference. So you have to think about it. If you are listen to English for 15 minutes a day, 1 year from now, you will have listened to only 90 hours of English. This is not enough. Not enough. Okay? Yes. So this is not enough. So it will take you many years to see an improvement. Okay? Not enough. So you have to do more than 15 minutes a day. Okay? Alright. Student, in this lesson, I give you a soft copy about the pronunciation practice. You will hear, okay, O, the vowel with a pronoun O is underlined in the key. Okay, so you have to find out the source, the material, okay, for the pronunciation in the Google Classroom. Okay, I already give it to you. Okay, in the Google Classroom, you have to find out the soft copy, okay, for this material for the pronunciation practice. Okay, student, let's have a look here. How to improve your English? You have to do the conversation if you want to improve it. So here is the conversation between nurse and the patient, okay, in the day of the operation. Okay, you have to fill in the gap. Okay, find out the answer from the words put, okay, in the below. Okay, you have to find out and get the answer, okay, when you have to correct it, and then you have to do the conversation practice with your friends. Okay, if you make a call with your friends, okay, you with video call, that's fine, or you have to make a call with your page, with the page, with your friends, okay, and you to be the nurse Russell and your friends to be Mr. Johnson. You have to practice the conversation. Okay, and here this is the day of the conversation between Nurse Russell and Mr. Johnson. You have to complete this conversation, and then you have to practice with your friend. Okay, although you stay at home, okay, I advise, okay, you have to make a call with your friends and do this conversation. Okay, student, do you agree? Okay, good. I believe it that you can do it. Okay, don't be shy to practice English every day. Okay, don't be shy to speak English in your daily of life. Okay, don't be shy. Okay, and then you have the dialogue the day of the operation too. Okay, this is the conversation between the nurse and the anesthetic. Okay, you have to complete this conversation. After you finish it, you have to practice conversation with your friends, okay, by video call. Okay, all right, good. And then after that, you have to say, you have to analyze yourself. Okay, this my pronunciation is good. Okay, so you can improve your confidence. Okay, student, in this English 5, I give you huge material. Okay, you have the grammar, you have the listening, you have the writing, and now you have a reading patience. Okay, you have to do this reading patient. Okay, all right, you have to read page 1, reading page 2, okay, reading page 3. You have to read all these questions. Okay, we have reading page 4. Okay, and then when you finish reading, okay, don't forget, you have to decide what is the best topic for the reading page above, because in that reading page, okay, there is no title, there is no topic, so you have to read the reading page and then you give the best topic, and then use your own word to describe the reading patient. If you want to improve, you have to tell again with your own word about the reading patient. Okay, student. After that, don't forget, you have to do this exercise. Okay, this is a short conversation. Short answer. Okay, yes. All right. Short answer from the question, from the reading page above. Okay. All right. This is easy. You can find out the answer, okay, from the reading. Okay, all right, so you can do by yourself. And then you have writing practice here. Okay, you have to read the inguinal hernia. Okay, the patient reading with inguinal hernia, and then you have to write 10 new vocab, find out the meaning, and then you have to share new vocab to your friend, your classmate, and then you have to try to write the sentences using the new vocab that you get. Okay, if you have time, don't forget, translate the reading passage. Okay, yes, okay, you can do it, I believe it. Okay, and also this is some exercise here. Okay, this is for the exercise, the conversation, you helping the patient. You have to find out the answer. Okay, find, sim, check, think, do, and better. Okay, all right. And you have another here, helping the patient, conversation, short conversation between the patient and the nurse. Okay, all right, student, I would like to advise you. Okay, even though you are studying at home, you stay at home. Okay, you have to spend your time, okay, study hard at home, doing the independent learning activity. Okay, spend your time to read. Okay, spend your time to listen the teacher, the lecture said. Okay, all right. Here for the independent learning activity, you have to write the conversation assisting the patient with inguinal hernia problem. The conversation, for example, hello, good morning, sir, how are you today? And then you have to continue. And then the last one here, you have to write the short conversation dealing with the nursing intervention. Okay, in dealing with inguinal hernia problem. Okay, student, I think that's all. Okay, thank you very much for listen. Okay, don't forget, you have to subscribe and like with my lecture. Okay, my explain about this subject. Okay, I wish you understand what I'm teaching in this English 5. Okay, my advice, okay, keep study hard at home, okay, keep healthy, okay, and keep practice, study hard, and then you can have a good mark in this English subject 5. Okay, student, thank you very much for your attention, and I wish I can see you again next week, okay, with a different topic. Okay, all right, student, let's close our studying by saying Alhamdulillah together. Alhamdulillahirabbil alamin. Don't forget, you have to subscribe and like and give a comment. Okay, thank you. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Have a nice day for you. Bye.